What is up, everybody? Today I'm going to be doing some of these questions regarding the MMI interview since I need to be practicing, it's that kind of season. And one of the questions that I tend to find quite difficult is the why medicine, right? That kind of question already like tricks a lot of people. And I know that if I were to be in an interview right now, I would probably fall down and stumble over. You know what I mean? Just turn off this fan so no white noise in the background. It's just purely my voice. So we're gonna start with why medicine. So medicine, as in, gonna break it into three parts. So my introduction into med, that's part number one. Number two, what made me stick into it, what made it shine from the rest. And then number three, God, I forgot what number three is. Hold on, I think I got number three is, yeah, what's gonna like what it offers compared to others. So one, intro. Number two, how I learned more about it. And number three, why I want to stick to it. So yeah, let's get cracking. This is gonna be unedited. The reason being, I don't like to edit things. I want to keep it as OG as possible. So why medicine? So I first got introduced into medicine once I began to, one, experience health problems myself, and two, see health problems in people like my community, my friends, my family. One example being one of my friends, he has a condition. He has type 1 diabetes, and this kind of prevents him from doing his duties when it comes to Ramadan. So, for example, it would be during Ramadan, we would be fasting, and he wouldn't be able to fast because he has to take care of his blood sugar and things like that. And then just witnessing that and being there for him and helping him with blood sugar and things like that, especially when it comes to exercise, fasting, and maintaining his what he wants to do in life. I think that's where I kind of got introduced, what kind of catalyzed my idea into medicine. And number two, I got a family member who actually has a condition, celiac disease. So celiac disease, when one of my family members first got diagnosed with celiac disease, one of my duties as a family member was to first understand labels, what is celiac disease in the first place, what the causes are, just so I can get an understanding of what I should be looking out for. And I think that kind of kick-started my whole research. I got really curious into the aspects of okay, this is due to that, so that causes that, that causes that, right? Like celiac disease is the breaking down of the villi in the small intestine, and then that prevents the absorption of other nutrients. And then one of the interesting things is the way one has to change their entire lifestyle to revolve around this diagnosis, and it can cause a lot of insecurities, I can imagine, especially for this family member of mine who finds it sometimes quite difficult to deal with not having the ability to eat things that you once really enjoyed. So this is something that I can see in a lot of patients. I can completely relate to a lot of patients, especially for me dealing with ulcerative colitis. I can kind of understand the aspects of how patients deal with this massive lifestyle changes when it comes to diagnosis. And I think one of the reasons why I really wanted to do medicine is because it's very interesting. One, understanding the causes of all these illnesses, and then number two, being an informer, being able to be there for your community, your friends, and things like that. I think that's really something that kind of aligns with my personality a little bit. Number two, how I learned more about medicine. So this was quite interesting. I got my work experience done at Salford Royal Hospital, and one of the key things that really popped out of the picture here is the way the ward rounds were set up. I remember being with the consultant at the time, under the wing of the consultant, the gastroenterology consultant, and we would do ward rounds. And I'm thankful for the opportunity to actually do that. And one of the things that I saw is the way the consultant broke bad news, like broke any like big, sometimes mentally challenging, news, like for example cancer and things like that. And just analyzing the body language, analyzing the way the doctor would be empathetic towards the patient was something that really like struck me. I felt like this is something I can relate to, like first being a patient and then also like seeing the way the doctor goes about it. I think it was really interesting. Also seeing the pressure, the situation, the medical department, how they worked around things. I think that was really nice to see the way nurses operate, the way the doctors operate. I think one of the reasons why I would prefer to be a doctor instead of like compared to a nurse, I think it's because the you have more of the ability to use your knowledge of like things you've learned, and put that into like practical use and take care of patients under your wing. So I think that's one of the key things that really popped out for medicine. One thing that I feel like medicine offers compared to like other careers is the fact that medicine just gives you the ability, like I said, to number one, be with patients and be like a massive help to your friends, your community, the people around you. Number two, it's like a puzzle a little bit, kind of like a puzzle. You learn these things and then you actually apply it into real life. I think that it's just like a puzzle, how it's satisfying. It can be really satisfying to help friends, help families get together and help them if they ever get diagnosed with something, help them go around life about it, so I think that's one of the key things that really stood out compared to like other careers. Yeah, that's why medicine. That's quite a waffly answer, but yeah, I'm gonna keep it short. I'm gonna keep it at why medicine, and then I'll probably like watch this video later. But if you want to watch and take a little inspiration, I don't mind. So yeah, that's it, y'all.